Hello, this is the VA Bootcamp Training Services, and in this video, I'll show you how to make progress reports for your doctors and patients. If you're a medical virtual assistant looking to add value to your role, or you're a healthcare provider looking to easily document your patient encounters, this video is for you. Let me show you how we do it at our medical clinic. As a virtual assistant, you have access to the patient's electronic health record. You can view the problem list, the diagnosis, the medications, the allergies, the immunizations, lab results, as well as all the doctor's notes from previous encounters. You can also access the patient portal, where you can view the patient's care plan and any handouts the doctor has given to the patient. And lastly, you can access the patient's message history from the chart. So let's say you're a virtual assistant and you've even asked by the doctor to generate a progress report for one of the patients. First, go to the patient's chart and click on Documents, and click on New Note. From here, select Progress Report. A progress report is a super bill that provides a summary of the patient's encounter. It's not meant to capture all the details of the visit, but rather a high-level overview. Let's start off by entering the date of the visit, which in this case would be today's date. Next, enter the patient's name. You can use the auto-populate feature to grab the patient's information from the patient's encounter. This saves you time from having to manually enter all the information. And if there's more than one patient on the super bill, be sure to update the patient information accordingly. Indicate whether this is an initial visit or a follow-up visit. For this example, it's a follow-up visit. So we'll select the type of visit and enter the reason for the visit. In this case, the patient is coming in for a follow-up regarding their diabetes management. The VA can document the patient's chief complaint and history of present illness. They can also review all the medications that the patient is currently taking, including over-the-counter medications and supplements, allergies, immunizations, as well as review any lab results that may be pertinent to the reason for the visit. All of this information can be found in the patient's chart. The virtual assistant can also access the patient portal where they can view the patient's care plan and any handouts the doctor has given to the patient. This can be helpful when documenting the patient's progress and treatment plan. Additionally, the VA can access the patient's message history from the chart. This can be helpful if the VA needs to clarify anything with the patient or the doctor. The VA can document the physical examination findings and any other pertinent information. In this case, the patient's blood pressure is slightly elevated, so we'll document that in the progress report. We also note that the patient's A1C is slightly elevated and that the patient is having difficulty managing their blood sugar levels. The virtual assistant can also document the assessment and plan. Assessment includes the diagnosis and any other relevant information. The plan includes the treatment and any other relevant information. In this case, we LAL note that the patient will need to make some lifestyle modifications, and that we LAL need to adjust their medication regimen. Once the VA is finished documenting, they can click on the Save button. The progress report will be sent to the provider for review and approval. Once the provider approves the progress report, it will be sent to the patient's insurance company. I hope this video was helpful. Let me know in the comments below if you have any questions.
And that ends our video. Hope this was interesting and we're glad to have you with us. Thank you for watching. If you like contents like this, don't forget to like, share, subscribe, and hit the notification bell for more updates.